Welcome back. Today we kick off Breast Cancer Awareness Month. It's obviously a very important time to shine a light on early detection and advancements in treatment. Joining us live to talk about it is Dr. Valerie Brutus. She is a breast surgical oncologist with the Hartford Healthcare Cancer Institute at St. Vincent's Medical Center. Dr. Brutus, thank you for being with us here this morning. And let me start right here. Can you talk about any recent breast cancer trends? What are you seeing from a medical point of view these days?
Good morning. Thank you for having me. We're definitely seeing that breast cancer continues to be the second most common cancer diagnosed in women, apart from skin cancer, and counts to about 30% of all cancer diagnosed in women. We are seeing a slight increased rates of cancer diagnosed in women who are less than 50. And this is what we're seeing right now.
What should women know about the latest breast cancer screening guidelines, and if there have been any changes?
There's been some change. Actually, the United States Preventive Task Force usually updated their guidelines and recommend that instead of starting to screen for breast cancer at the age of 50, that women should have their screening mammogram starting at the age of 40, and that applies to women who are at average risk for breast cancer. So I think it's important for women to know their risk and understand, what screening guidelines applies to them.
Dr. Brutus, although breast cancer obviously most often associated with women, what information should men know about it as well?
You are correct. So most of the time it's more common in women, but we do see breast cancer in men. This year alone, about 2,300 men will be diagnosed with breast cancer, and about 500 of them will die from the disease. I think it's important for men who have an extensive family history of breast cancer, or who knows if their relatives who are carriers of genetic mutation that put them at increased risk for breast cancer, that they should talk to their provider about breast cancer screening.
From a treatment point of view, what options are available now for patients?
At St. Vincent's Hospital, and as part of the Hartford Healthcare Cancer Institute, we offer a wide variety of treatment. We were one of the first hospitals in Connecticut to offer some new innovative treatment for our patients. That includes something that's called delayed sentinel node biopsy, where we sort of inject some dyes, and that allows us later on to determine if patient needs to have the lymph nodes removed. We are also offering, nerve-sparing mastectomy, where the nerve are preserved or reconnected to allow sensation back, to the breast after reconstruction. And we're also offering new surgery that allows us to decrease the chance of lymphedema in patients who are at increased risk to have this complication as part of their cancer treatment.
And Dr. Brutus, you have a webinar coming up. Can you tell us a little bit about that?
Yes, I have an upcoming webinar where I will be discussing about, more details about surgical update for treatment for breast cancer. So breast surgery has remained a very important, part of the cancer treatment. And now the trends are to just offer more precise surgery, surgery that's less aggressive, and to continue to offer our patient latent evidence-based comprehensive cancer care.
And do people have to register in advance for this?
Yes, they can register in advance, or they can join in. I think it's important to raise awareness for breast cancer during all year, specifically in October.
All right, Dr. Brutus, we appreciate your time this morning. Very, very important subject.
Thank you so much for having me.
Thank you.